once you finish up with the suturing part of it and getting that foundation ready now for the prosthesis, right? You got healing caps that are exposed around tissue that is now brought back together. Yeah. Right? The bone is no longer exposed. Yeah. So now you're reviewing what the case looks like.
Yes, I'm checking. I mean, maybe I'm trying abandments because we have different ways to do this part, because sometimes we do this 100% digital, sometimes we do it 50% digital, 50% the analog way, okay? So in most of the cases, what we do is that we already have this denture or this duplicate of the WhatsApp or the possible position that we planned based on, remember, all the pre-op part where we have all the information about your bone, your actual position of teeth and everything. So we do a WhatsApp that's like a mock-up of where we want the teeth for this type of prosthesis, and we print that. Now I need to transfer that from the digital world to your mouth, to the analog world. So I'm going to your mouth. I have different references. In this case, I have your palate and I have other references, that I'm going to attach this to the recently placed implants.
Yes.
And then I'm going to start playing and I'm going to do a bite record with that. So I'm going to use it in the prosthodontic field. We call this like a rim, bite rim. So I'm going to use this WhatsApp, printed WhatsApp that is, you have your teeth. It's a printed complete denture, basically, okay? Without all the flanges and without all the tissue touching on top of the ridge, because we only have contact with the palate in this case. So we adapt and we partially convert that complete denture, printed complete denture, to the position of your new implants. And then I'm going to be able to do a bite record. And it's going to be a very stable position because this is a screw-retained device that is not going to move. And I'm going to be able to check other aesthetic factors, for example, the position of your anterior teeth, the midline, the occlusal plane. So I'm going to start playing a little bit with that. Based on that, I'm going to start connecting the virtual planning with the analog world, that's you, okay? And I'm able to check we are on track or not. We need to do changes. We need to change position of some teeth or not. So this is a very important part of the process because we can recheck what we have done in the digital world with your face. That we already had that information, remember, with the face scan, with the CBCT and all that. But I'm rechecking. I'm able to touch that part again and see it in your mouth and say, okay, yes, we did great. The midline is good. The occlusal plane is good, or not. We need to change these 2 millimeters, 3 millimeters here. We need to angulate this. And then based on that bite record, I'm going to be able to transfer that information to the designer, and he's going to be able to do minor changes, no changes, big changes. It depends on every case. But at this point, because we do this on a daily basis, the technician is very well connected with us in communication. So we don't do a lot of changes, because we are already very close, but it's very important to check it.
So you end up, I know they called you for your patient, and patient, if this is you watching it, I'm sorry I'm keeping them an extra 2 minutes, but if you guys take you planned denture, the one that's pre-printed, it goes in, if I'm hearing you right, you now go, okay, which I saw you adjust a little bit because, again, there might be audibles in the surgery part of it, right? An implant might have to be adjusted. Is that a fair?
Basically, what we do is that we need to open like these windows on that printed denture to be able to bond it to the newly placed abutments, because we have the multi-unit abutments, the one that Dr. Iskander placed, and then on top of that we have these titanium cylinders that are screw-retained to those abutments, and those are the ones connected to the prosthesis. So in this case I need to open like these windows to be able to sit it and connect it to those abutments, so then I can take it out and mount it and do whatever I want.
So once you've done that and you now got it to where it's going to sit, do you then take it back to the lab and then that's what they printed the next 24-hour set off of?
With that information, they will be able to have a newly recorded bite So I'm going to have a bite in that moment. I'm going to be able to verify, as I said, all the information that we planned digitally.
Yes.
So yes, I said, yes, everything is good. The bite is this, proceed. So they will able to digitize again that analog portion of the process. Once they digitize that analog portion of the process, we start from a next level, because we already have,
more data.
Yes, we already verify all the digital files, we already make them match with your face, we already make them match with your bite. Now we start next level. Let's go and continue with the designing of the new prosthesis that is going to be a completely newly designed, of course, based on all the wax up and information we just gave to the technician.
Okay. And then once you give that to the technician, you put the denture in my mouth. It's then, you guys had it there for 24 hours? Isn't that what we did?
I mean, basically, imagine this, I don't know, this is at noon or something like that.
Yeah.
So we delivered the immediate load prosthesis that is a newly one piece. In this case, it was milled, but sometimes we mill or print. We have different options. But we design and create a one-piece prosthesis for the next day, okay?
Yeah, because it's drastically different. I mean, going from this one that you put in here to that next one was just
because as I said, this one is not your prosthesis. This one is just a device that I'm going to use to collect the data and to connect things and to make a bite record as a prosthodontist. It's not just like, let's guess. No. This is, I mean, like it should be. Yeah.
Okay. I think you have answered every part of where you did on that. If we're still here, we'd love to invite you back when you're done with your patient. But if not, if we do finish up ahead of time,
Perfect.
Thank you.
Thank you so much.
I really appreciate it.
Thank you.